How do doctors test for Hpylori ulcers? Have you ever wondered how doctors figure out if Hpylori is causing your ulcers? Understanding the testing methods can help you feel more informed about your health. Doctors use a variety of tests to detect Helicobacter pylori, a bacteria linked to stomach and peptic ulcers. These tests fall into two main categories: non-invasive and invasive. Starting with non-invasive tests, the urea breath test is one of the most common methods. In this test, you drink a special solution containing urea that has a carbon isotope. If Hpylori is present in your stomach, it breaks down the urea and releases carbon dioxide. This carbon dioxide can be detected in your breath, making it a highly accurate test. It's suitable for both adults and children over 6 years old and is also used to confirm if the infection has been cleared after treatment. Another non-invasive option is the stool antigen test. This test checks for Hpylori proteins in a stool sample. It's widely used for both diagnosing the infection and monitoring after treatment. There's also a more advanced stool PCR test that looks for the bacteria's genetic material, but it's less commonly available and tends to be more expensive. Blood tests or serologic tests can detect antibodies against Hpylori in your blood. However, these tests have limitations. They can't tell if you have a current infection or if it's a past one, so they are not the best choice for confirming active infections. Now let's talk about invasive tests, which requiring an endoscopy. During this procedure, a small camera is inserted into your stomach, allowing the doctor to take a biopsy or tissue sample from the stomach lining. This sample is examined under a microscope to check for Hpylori and assess any damage to the tissue. Another invasive method is the rapid urease test. In this case, the biopsy sample is placed in a medium containing urea. If Hpylori is present, it produces an enzyme that breaks down the urea, changing the color of the medium, which indicates an infection. Doctors can also culture biopsy samples to grow Hpylori for antibiotic sensitivity testing. This helps in tailoring treatment based on the specific strain of bacteria and its resistance to antibiotics. When deciding which test to use, doctors consider factors like your age, symptoms, and any alarming signs such as bleeding or weight loss. Non-invasive tests are usually preferred for younger patients without serious symptoms, while invasive tests are reserved for more severe cases. Testing for Hpylori is crucial for managing peptic ulcer disease. It helps guide effective antibiotic treatment, reducing the risk of ulcer recurrence and complications. After treatment, doctors typically confirm eradication using the urea breath or stool antigen tests rather than blood tests. If you suspect you have an ulcer or are experiencing symptoms, it's essential to consult with a healthcare professional. They can recommend the best testing method for your situation and ensure you receive appropriate care. Understanding these testing methods can empower you to take charge of your health and make informed decisions.